And do those case studies stay there?
It depends. So if they don't have active cancer, we'll keep them in that clinic. But if they have an active cancer, then they'll come out. I say that I'm bringing them home. So I'll bring them to my separate clinic or to another, if I have a colleague who's better equipped to deal with that. But we always maintain that annual follow up with our geneticist in case, and our genetic counselor in case there's any new information, that has come out, something that we can collaborate together and make sure that that patient and their family, that they have access to.
I'm thinking about, machine learning, like I said, being used to analyze past clinical trials. These case studies get so specific. And, like you get diagnosed with a rare autoimmune eye thing that only
Yes.
a few people have and randomly in Chicago. And it's like, it's usually does this, but it's doing that. And then you're like, okay, well, we've kind of figured it out, but what if someone else has the same thing?
Well, it's
How
true.
can we, Northwestern has like, I think
Yeah.
it's called the New Gen something,
Yeah.
but like, I'm wondering, like, how do other people outside of that hospital system have access to those insights from those cases? It
I
feels like
mean,
they're reinventing the wheel every time.
one of the things you can do is get online and start searching. And if you see a doctor's name pop up over and over, reach out to that person. There's a steep learning curve into how to be an advocate for yourself, in the medical world. And there are organizations that can help you, but if you hop on PubMed or you hop on clinicaltrials.gov, or now with AI, you can go to AI and do it and say, who are the experts in this area? Who has published the most on this? Show me, this data. And it's pretty easy to get contact information for those people. And if you have a physician that's publishing on something and that's their passion, they will love to talk to you. I mean, I have patients from all over the world who message me with H3K27 tumors. And every time I'm like, yes, I mean, I hate it. I don't want anyone to have it.
Yeah.
But if I can help them, it's just such a gift to
Yeah.
have that knowledge and be able to help.
If you could leave us with, I know there have been so many sessions here, right? Either something that has stood out to you that you've seen in your time here at ASCO, or just one final statement for your fellow physicians.
Well, I have two of them, I guess. One study that really stood out to me that wasn't highlighted that much was a study where exercise was used as an intervention for patients with colon cancer, and it improved survival. So what I loved about this study is exercise is free and available, and it makes a difference. And it part of that takeaway is that doctors and patients can partner together and do simple modifications in lifestyle, and we show that it makes a difference. The message that I always give my friends and colleagues and even my patients and their families is to be an advocate for yourself, be an advocate for your care. And part of that includes educating yourself about what's going on in our country, and reach out to your policymakers, reach out to your lawmakers, share your stories. They do make a difference. We are incredibly blessed to live in this country, and we have the ability to impact policy. So if you want to have federally funded clinical trials for cancer, tell someone.
Yeah, that's a great place to leave us. Thank you so much for joining us on MD Newsline. It's been a pleasure.